Hello and welcome to the EDU-TALK Diabetes series hosted by EZ, Biotone, and diabetes health and wellness experts. With the daily challenges of diabetes and interest in health and wellness strategies, the EDU-TALK Diabetes series supports building your wellness community by connecting you with diabetes health experts who share their knowledge and expertise on topics of concern to provide you the tools and resources to support and manage a healthier lifestyle. Today's expert is Linda Lockett-Brown. Linda is the president of Cinet, Registered Dietitians and Wellness. Her eDSMEs, Diabetes Education Program, is nationally accredited and can be completed online, by phone, or in person. Her approach empowers people with diabetes to master the 7 key behaviors. She has been featured on TV, radio, and podcasts, and is a past presenter for the EDU-TALK Diabetes series. You can catch her past presentations in the EDU-TALK Diabetes library on ease-z.com or biotone.com. Let's listen and learn as Linda explains how, quite often, clients, family, patients search frantically for that supplement that lets them eat whatever they want without raising blood sugar. There are good reasons for caution when taking dietary supplements and diabetes medications. Linda will reveal what works, what doesn't mix, and what is downright dangerous. Again, thank you for having sound muted and video off. Please feel free to chat questions or comments during Linda's presentation, which Linda will answer at the end. And with that, welcome, Linda. Good to have you back again.
Hi there, glad to be here.
I am going to turn the screen over to you. It's all yours, and I'm looking forward to your presentation. Thanks so much.
Well, thank you for having me, and I'd like to thank Easy and Biotone for actually sponsoring this, because my philosophy is the more you know, the better you can take care of yourself. So we're going to talk about some pretty interesting, or things at least I find interesting. And let's get started. So as the introduction said, I see clients, and some of them are just, they're desperate, they're frantic. And so if you go online and you look at something and you just type diabetes and supplements, you're going to get thousands of hits. So after tonight, you'll have a little better perspective of what you are looking at. So I'd like to start with a disclaimer. Nothing in this presentation is intended to provide medical advice, and you want to consult your physician before changing any part of your medical regimen. And if I show a branded product, it is for educational purposes only. So we're going to talk about what works, what might work, what doesn't, and what's potentially harmful. And what I find interesting is I looked at this topic about 6 months ago when I had to give information about what I was going to talk about, and I updated what I looked at in the last few days, and it has already changed. So what we say today may be different 6 months from now. So I went on WebMD and I looked for supplements that WebMD considered appropriate, or supplements that they had evaluated for use in diabetes. And so they have looked at 310 supplements, and of the 310 supplements, 38 of them were evaluated as possibly effective, 16 were evaluated as possibly ineffective, one was evaluated as likely ineffective. And the vast majority of them, 255, there was insufficient evidence to even say one way or the other. So there are some potential problems when you are taking medications for diabetes and taking supplements. And so here are 4 ways that you can get in big trouble. One is you combine supplements, you combine them on your own. Another way you can get in trouble is to combine the supplements with your medications. Another way you can get in trouble is to take too much of a supplement. And probably the worst thing you could do would be to just take supplements and not take your prescribed medications. So there's one very important thing, and I would call this the elephant in the room. And the important thing is there is nothing that is going to replace good food choices and physical activity to control blood sugar. There is not a supplement on the planet, nor will there ever be a supplement on the planet that's going to eliminate the need to make good food choices and move as much as you can. So as we go through the presentation, I'm going to be talking about food because food is foundational. So I want you to think of that. Food is foundational. And if you choose to use a supplement, you have food as your foundation, and the supplement might be something that you do in addition. So, and this is also a really good example of one of the limitations of supplements. So you probably heard of polyphenols, and they are extremely potent antioxidants. And polyphenols from food have been shown to help control blood glucose and reduce some of the complications. So here's a list of food sources of polyphenols: just tea, coffee, cocoa, fruits, grains, and vegetables. What is fascinating is if you take the active ingredient, so if you actually take the polyphenols out of these foods and put it in a supplement, you do not get the same results. So the polyphenols are more potent, more active when they are in food. Now, I wanted to begin with just some background information so that I want to give you some perspective. Dietary supplements in the United States are not regulated. I want to say that again. In the United States of America, dietary supplements are not regulated. They are regulated in Canada and Europe, but not in the United States. So if you look at the Food and Drug Administration, what you see is the Food and Drug Administration has a lot of hats. They are responsible for food, and they're not doing really well with that right now with all the recalls. They're responsible for drugs. They're responsible for vaccines. They're responsible for mass outbreaks. And so if you look at this whole slide, what you will not see on there is you will not see supplement regulation. So there's a law that was passed in 1994. It's called the DSHEA law. And what that law does is define the role of the FDA. So this is from the actual law itself. And so the FDA does not have the authority to approve dietary supplements for safety and effectiveness, or to approve their labeling before the supplements are sold to the public. Now, I just want to pause a minute and let you think about that. The FDA does not have the authority. Another provision in the DSHEA law is that it says under the FD&C Act, it is the responsibility of dietary supplement companies to ensure that their products meet the safety standards for dietary supplements and are not otherwise in violation of the law. So what is this really saying? Is the FDA does not have the authority, and we are depending on supplement manufacturers to do the right thing. Now, one thing that is required is there is a supplement backs label that is required. And so that label has to have the serving size, the number of servings per container. There has to be a list of all the ingredients, the amount of each ingredient per serving, and then some descriptive term on the front that tells you what it actually is. When you look on a supplement label, there's always some sort of claim, some sort of statement on the front of the bottle because they want you to stop and pick it up. And so you'll see a statement, and the example that I'm using here is supports brain health and cellular energy. And then that little asterisk is required. And so somewhere on another part of the label, there'll be a little asterisk, and there will be this statement. And it says, this statement has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. And so the reason why that's on there is because if that was the intent of the product, it will no longer be a dietary supplement. It would actually be a drug, and then it would be regulated by the FDA. Because we are in an environment where terms are not defined, if you see something that says all natural, the term all natural has no legal definition. I want to say that again. When it comes to dietary supplements, the term all natural has no legal definition. So if I took that bottle on the previous slide, went out and filled it with this pile of dirt, put the lid on, I can say it's all natural. I can say it's all natural. So you say, well, is that a problem? It can be. There was the Royal Society of Chemistry published a study just this year. It was published in March of this year, where they looked at 4,000 products that contained just 5 ingredients. They were only looking for these 5 ingredients: black cohosh, echinacea, elderberry, ginkgo, and turmeric. So they looked at these products and they looked at the studies surrounding them, and what did they find? They found that 27%, almost 1/3, 27% of the products did not contain the amount of active ingredient that was on the label, or they were contaminated with something that wasn't on the label. So do you have any protections at all? Yes, you do. Yes, you do. And so there's a thing called third-party verification. This is really the only protection that you have, and that's third-party verification. And so you've probably heard of Consumer Lab. And what I like about the way Consumer Lab evaluates products is they don't let the manufacturer ship a product directly to them. They actually go to the store, or they'll go to the Walmart, they'll go to the Walgreens, or whatever drugstore you have in your area, and they will actually pull their samples off of the shelf so that they're getting the same product that you would be getting as a consumer. So if you see a supplement and it has this mark on it, this is a registered mark, and it can only be used legally if Consumer Lab has signed off on it. So if you see this on a supplement, what does it mean? It means that this product has been tested for quality. It's been tested for contaminants. It's been tested for the amount of the active ingredient, and it's also tested for how quickly it dissolves once it's inside your body. So this is an independent test that if you see a supplement that has this label on it, then you know that the label, what's in the bottle is the same as what's on the label. So there are two other third-party verifications, and one of the first ones was actually the USP verified. So there's a line of supplements that they proudly say we were the first to be USP verified. And then the NSF, this is particularly important in sports and for the military. So a military person who uses a supplement that does not meet NSF criteria, if they find it in their body, they could get in some big trouble. So this is really the only protection you have: Consumer Lab, USP, or NSF. So with that background, let's talk about what works to lower blood sugar. Now, we're not going to go over all 310 items, but just going to hit some high points. And so one thing that we know works is eating high fiber. So eating high fiber to control blood sugar does work. So there's two kinds of fiber, soluble and insoluble. So the soluble fiber forms a gel. So if you've ever actually cooked oatmeal in a pot, you'll notice that on the top of the oatmeal, you'll see this, it looks like a gummy gel. That is the soluble fiber. And so that fiber helps with control of blood sugar and decreasing your risk of heart disease. Now, the insoluble fiber, which we used to call it nature's broom, it does something a little different. It helps with decreasing the risk of constipation and decreases your risk of heart disease. That is assuming that you are drinking adequate water. So if you think about food sources of fiber being foundational, then optimally you would only be adding supplemental fiber to get you up to the 50 grams a day. So none of the research shows that there's any benefit to be gained in blood sugar control by increasing your fiber higher than 50 grams. The caution here is with fiber, because fiber has to absorb water and then it's either going to form a gel or it's going to swell. You have to have enough water. Now, if you went out and bought a fiber supplement and tomorrow went and ate or took enough of it to get 50 grams, you're going to be in big trouble. The key to this is, even with increasing your fiber intake from food, you need to start slowly. So what happens if you don't? So if you don't start slowly, you get all motivated and you go and you consume too much, you're going to be miserable. You get gas, bloating, cramping, diarrhea. Worst case scenario is you start too fast, don't drink enough water, and you actually end up with an intestinal blockage. That will end you up in the hospital. So you're more likely to have these problems if you are using supplements as your primary source of fiber. You're less likely to have these problems if you are using food as your primary source of fiber. The other caution with fiber is it can bind, the soluble and the insoluble can bind with medications. So you have to be careful with that. So there have been basically three kinds of fiber. Well, there's been lots of kinds of fiber tested, but the three that have shown the most promise in controlling blood sugar have been psyllium, beta-glucan, and raw guar gum. So this is raw. And so I wanted you to have the measurements and the amounts. So what the research is saying is 10 to 15 grams a day of psyllium may help control blood sugar. A teaspoon is 4 grams. So you're looking at least 4 teaspoons of psyllium. Beta-glucan, the amount that may be helpful is 5 to 10 grams a day, and 4/10 of a teaspoon is 1 gram. And then with the guar gum, 1 teaspoon is 2.8 grams, almost 3. So you would be looking at 5 to 6, or perhaps more if you want to go 5 to 7 teaspoons a day to help with glucose control. So now we're in the category of what might work. So that would be the category of possibly effective. And you probably heard about this already. Berberine is all the rage. And if you've tried it, your experience with it is totally going to be brand dependent, because each brand, each company that has berberine supplements uses a different process for how they handle the berberine. But here's what the research says. Berberine does improve blood sugar levels, A1C, and insulin sensitivity. So insulin sensitivity is really what makes you a type 2 diabetic. You are insensitive or insulin resistant. So anything that increases insulin sensitivity is going to decrease your blood sugar. Berberine and metformin work very well together. They work very well together. The only problem with the research that showed they worked well together is that the studies were very short, like 6 weeks. The longest one was maybe 3 months. Well, we need more research, because 6 weeks, 3 months, that is not enough time to know the effectiveness for a long period of time. So they did study someone taking 1.5 grams for 6 months. And so they broke it up and took it just before meals. Now, berberine interferes with a lot of medications. This is just a partial list, but one of them is a blood pressure medication. It interferes with cough medicine, Versed, which is they give you Versed when you're going to have surgery. Berberine interferes with oral contraceptives, and it interferes with cyclosporin. So if you decide that you want to use a berberine supplement, you need to make sure that it does not interfere with any of your prescribed medications. So here's some warnings about berberine. There weren't a lot of reports of adverse effects, but the adverse effects, the reports did go up when people took more than 1.5 grams in a day. And so some of the adverse effects are nausea, diarrhea, constipation, abdominal swelling. Now, there is a caution. Do not use berberine if your fasting blood sugar is less than 100. Because if your fasting blood sugar is less than 100, you take the berberine, your blood sugar is going to go down, and you may have a low blood sugar reaction. You also don't want to use berberine if your A1C is less than 5.7. And so for all of the supplements that we're going to talk about tonight, none of them are advised in pregnancy. None of them. So let's say your doctor was going to do some lab tests to check on your liver function. So they might be measuring bilirubin. You would need to stop taking berberine 7 days before you get that test done. Many of the references that I looked at raised cautions about berberine plus these other herbal supplements, and that's aloe, bitter melon, cinnamon, chromium, and prickly pear cactus. So there are numerous reports of people having low blood sugar or hypoglycemic reactions when berberine was combined with one or more of these other herbs. So just be cautious about combining things. And if you decided that you wanted to try berberine, or if you wanted to try aloe or bitter melon, the recommendation is you try these supplements one at a time. So you would do berberine and try it for a week, monitor your blood sugar. If you don't get the desired results, then you would add another supplement and do the both of them together for a week. But you have to be willing, if you're going to do this, you have to be willing to monitor your blood sugar closely. So another supplement that's in the category of possibly effective, and that's magnesium. So magnesium is a mineral, and we know that if you have been on a proton pump inhibitor, like the medications they give you for acid reflux, over time, you're going to be deficient in magnesium, calcium, iron, pretty much any of your minerals. You're going to be deficient in those. So we have solid research that shows that magnesium in supplemental form does improve insulin sensitivity. It improves fasting blood sugar, and there are some additive effects. So if you take your prescribed diabetes medications and magnesium, there's an additive effect. So they work well together. And this is also true with the supplements that we saw on the previous slide. So magnesium is highly interactive. So if you decide that you're going to take a magnesium supplement, you want to make sure that there is 6 hours between the time that you take your prescribed medicine and the time that you take the magnesium. So this just shows you, this is just a short list of the classes of medications that magnesium interacts with. So we have antibiotics, we have the bisphosphonates that they give you for osteoporosis. So there's 2 categories of antibiotics, and we have calcium channel blockers. Those are for blood pressure. So magnesium interacts with each of these classes. So if you decided you wanted to try magnesium, you really need to check with your pharmacist and make sure there's no interaction. So another mineral that has been shown to have some benefits in controlling blood sugar is zinc. And so zinc acts in a lot of different places. It acts in the actual absorption of glucose. It decreases it. It increases glucose uptake in the muscles. And so both of those things would help lower blood sugar. It reduces oxidative stress. So that's going to help with prevention of some of the side effects that come along with diabetes. And then zinc also improves insulin sensitivity. So that means you'll be less insulin resistant. And when you're less insulin resistant, you're going to have that increase in uptake. So blood sugar levels go down. Now, I wanted you to see, remember, I said that food is foundational. So here are the foods that are good sources of zinc. They're also good sources of fiber. So that's kind of a win-win. So you need to be careful with zinc. And so the highest dose you would ever want to take of zinc in a 24-hour period is going to be 20 milligrams. But it would be better to start with 5 and then check your blood sugar frequently. And if you get your blood sugar where you want it, then don't increase the zinc. Now, notice there's a very small window between effective and toxic when it comes to zinc. So effective maximum would be 20 milligrams, 40 milligrams a day, toxicity. Now, I listed the best forms of zinc. So zinc sulfate, citrate, gluconate, picolinate, and bisglycinate, those are the best forms. And if you've ever looked at zinc supplements, you also know these are the most expensive forms. But when it comes to zinc, you want to get a form that is highly absorbable and very stable. So zinc needs to be taken on an empty stomach for maximum absorption. So one thing you would never want to do would be to take your zinc and your magnesium together. So we have research that has shown that there is a risk of low blood sugar if you take zinc with your diabetes medication. So the previous slide, it may look like a contradiction, but what it's really telling you is you're going to get the best absorption of zinc on an empty stomach, but you also may get nauseous. So if you take the zinc on an empty stomach and you get nauseous, then you would just take it with food. And then you want to separate the zinc at least an hour from when you take a supplement with calcium, iron, or magnesium, or you certainly would not want to swallow your zinc supplement with a glass of milk. You would not want to do that. Zinc also interferes with antibiotics, so you want to separate those by 6 hours. And this last point is very important because a lot of people, it's kind of like when they become diabetic, everything falls apart. So blood pressure tends to be higher in some folks with diabetes. So if you are given a thiazide diuretic to control your blood pressure, you're going to be losing zinc with that medication. So just something to be aware of. So this is one, another mineral, chromium. We have data to show that chromium may reduce fasting blood sugar and A1C, doesn't do anything for insulin resistance. The chromium picolinate may be a safe form because think about chromium is a heavy metal, so you want to be careful with it. And you don't need much. So we're looking at 600 micrograms at the low end, 1,000 micrograms at the high end with meals. And you wouldn't want to take, if you decide I'm going to go with the 600, you don't take all 600 at once. You would do 200 with breakfast, lunch, and dinner. And that way you get your 600 micrograms. If you have a problem with your kidney or your liver, you cannot take chromium supplements. So it's not safe if you have kidney or liver disease. So chromium is just like the other minerals we've already talked about. It interacts with a lot of different medications. So chromium, just look at this list: antacids, steroids, those proton pump inhibitors, H2 blockers, beta blockers, insulin, nicotinic acid, that's a B vitamin, NSAIDs. So you need to be careful with supplementation of chromium. And then we have omega-3s. So omega-3s, everybody knows omega-3s help with decreasing your risk of heart disease, but they may also reduce fasting blood sugar and improve insulin resistance. So now we're going to shift to what may not work. And so you may say, well, how do you know it doesn't work? The reason why we're saying it may not work, it doesn't necessarily mean that it doesn't work. What it may really mean is we don't have enough research. And it is really hard to do research in humans. So what generally happens is the research is started in mice. And if it looks promising in mice, then someone will fund it to be done in humans. So Gymnea extracts, you probably heard of those. Gymnea sylvestri is a common one. In animals, it lowered fasting blood sugar. But what was interesting, they did the research in animals, fasting blood sugar was lowered. When they did the research in humans, didn't work. But what Gymnea does, it's a fiber, it's a soluble fiber. It reduces the absorption of glucose in the intestines. It's been on the market for many years for weight loss, and it may actually lower triglycerides, which is beneficial because elevated triglycerides increase insulin resistance. Now, what is exciting to me about what Gymnea may do is Gymnea may be one of the few things that can save or preserve beta cell function in the pancreas. And the beta cells in the pancreas, those are the cells that make insulin. So if it is shown that Gymnea actually preserves beta cell function and perhaps stimulates beta cell growth, that actually gets at part of what makes a person diabetic. And I'm talking about type 2 diabetes, not type 1. The downside of Gymnea is it interacts with a lot of medications. So here's a list of supplements that may not work in diabetes. Banaba leaf, branch chain amino acids, creatine, glycine, selenium. Selenium is another heavy metal, so everything that applied to chromium would also apply to selenium, vinegar, and vitamin C. So we got a couple of herbs, some vinegar, and some vitamin C. And, you know, people are on this thing about apple cider vinegar, and the real benefit to apple cider vinegar is it decreases the rate at which your stomach empties. So anything that decreases the rate at which your stomach empties is going to, instead of you having a big spike in blood sugar after a meal, the spike may be lowered because the food is staying in your stomach longer, and your intestines and your insulin levels have a chance to deal with it better. So now let's talk about what can actually hurt you. Remember, we talked about combining things. So this is the same list that I showed you earlier, but combining cinnamon, St. John's wort, aloe, bitter melon, chromium, and prickly pear cactus can result in low blood sugar to the point where you might end up in the hospital with a blood sugar that's extremely low. I have so many clients that believe that cinnamon supplements are going to help them. There is some data to show that cinnamon can reduce fasting blood sugar. the active ingredient, can increase insulin production, possibly reduce insulin resistance, possibly reduce glucose absorption, might help reduce blood pressure. But here's the downside. There's a couple of downsides. One is you have to do 2 grams a day. So if you're grabbing your little cinnamon shaker that you have at home, that's not going to be enough. And the other problem is purity. So purity and concentration. Purity and concentration. The other downside to cinnamon is it interferes with a lot of medications. So one of the components in cinnamon is actually coumarin. And if you think, I've heard that before, coumarin is a blood thinner. So you don't want to take a cinnamon supplement if you have liver disease, liver damage, a liver transplant. Cinnamon is not safe. If you are on a blood thinner like Eliquis, you don't want to do cinnamon because that's like increasing the dose of the blood thinner. 3 to 6 grams a day may cause liver damage. And so the problem is if you are taking a cinnamon supplement and is not from a source that is third party tested, you don't know how much of the coumarin is actually in the cinnamon. You don't know how much of the active ingredient is there. And so the other thing that you have no way to know is you may have your friend down the street that took this much, and then you take that much and you have a bad reaction. We don't have a way to test for sensitivity right now. Another supplement that may be harmful is Golden Seal. Golden Seal interferes with metformin. So if you are taking metformin, it's controlling your blood sugar, and you add Golden Seal, your blood sugar will probably go up because the Golden Seal interferes with the metformin. So just a general overall word of caution, low blood sugar is a risk whenever you are combining herbal supplements and prescribed medications. So I wanted to end with, what do you do if your blood sugar goes low? So how would you even know? So family members always talk about the grouchy, but you could be lightheaded, weak, sleepy, you're very, very hungry, your vision gets blurry, you get a headache, you can't concentrate, you're sweating, your heart rate's up. Then you want to check your blood sugar. And if it's less than 70, you want to treat it. So what do? You check your blood sugar, and you're going to treat with glucose tablets, glucose gel, 4 ounces of juice, not a whole glass, 4 ounces of juice, 4 ounces of regular soda, 3 to 4 sugar packets, 3 to 4 hard candies, regular candy, regular peppermint, not sugar-free, or 5 to 6 lifesavers. What you don't want to treat low blood sugar with, you don't want to treat it with chocolate candy. The main source of calories in chocolate candy is fat, and the fat will not allow the sugar to leave your stomach. So if you're having a low blood sugar reaction, do not treat that with candy, chocolate candy. So you want to follow the rule of 15. So what is the rule of 15? If you think you're having a low blood sugar reaction, if you can, check your blood sugar, then you're going to eat or drink 15 grams of carbohydrate, and everything that I mentioned on the previous slide is 15 grams of carbohydrate. And you wait 15 minutes. If your blood sugar is still less than 100, then you repeat the process. So that's the rule of 15. So I like glucose tablets for my clients because you can put them in your purse, you can put them in a pocket. If you're out taking a walk, you can stick them in your exercise gear. And then I also like glucose gel, because let's say you are out, not totally conscious, someone can grab the glucose gel. If you're semi with it, you can just twist the top, squeeze it in the side of your mouth. You want to put it toward the side of your mouth, inside your mouth, between your gum line and your jaw. Just squeeze it. If you can swallow it, fine. If you can't swallow, it will leave your mouth and go directly into your bloodstream. So I like glucose gel. If you watch the Olympics, there were a bunch of people with glucose in their gear. So just to summarize what we've talked about, the first thing is you want to talk to your doctor before you take anything. Just know that supplements do not replace your prescribed medication. Some supplements, when used in combination with your prescribed medications, can cause low blood sugar reactions. If you decide you want to use a supplement, then you add them one at a time, and you have to be willing to check your blood sugar more often. And I would caution you to avoid products that have more than one potentially active ingredient in them. It's better to do it one at a time so that you can monitor your reactions. So now I'm more than happy to answer your questions.
Well, thank you so much. We did have 2 chats come in, and everyone, there is still time. And Linda, would you mind closing your screen so we can see you? Great. Susan asked, I saw tea as being a source of food. I sip green tea over coffee to try to prevent. Is black tea also good possibility?
Yes, it is. It is. Green tea is good. Black tea also has polyphenols in it.
All right. And Susan has another comment here, question. I also heard that they say adding cinnamon to apples or berries can help control sugar, but is it only in tiny amounts?
Kind of the way I look at that is, if you're adding cinnamon to your fruit salad, go for it. But I wouldn't consider that as a major thing, because we're talking grams in order for cinnamon to help control blood sugar. But one of the things you probably noticed is that there are additive effects. So it is not going to harm. It may be helpful to add cinnamon to some of your dishes, some of your salads, some of your fruits, and you may get a little bit of additive benefit, but it's not going to be a big one. Not going to be a big one.
Okay. And Mandy is asking, as a massage therapist, what would the maximum absorption through the dermal applications to client skin of, it looks like the EZ lotions, because EZ contains zinc.
That is a really excellent question. You're not going to get enough absorption of zinc through the skin to cause the kind of reactions that I was talking about, because most of the zinc is going to be absorbed and used right at the skin level. So that's not an issue. Now, if a person had a 3rd-degree burn, that's a different conversation. But just the way you would use it in a massage, it's not going to be an issue.
And no risk to the therapist either, using
No.
okay.
No.
Great. I had a question. Gummies, vitamin gummies. do we think about those the same as we would taking a capsule?
That is a really good question. Generally, with vitamin gummies, the amount of the vitamins and minerals in there is going to be lower. It's going to be lower because if a lot of these things don't taste good. So in the gummies, they're really trying to get it in a matrix where when you put it in your mouth, the first thing you taste is the flavor of the gummy. So if you look on the label, it'll tell you like how many milligrams of whatever you get for each gummy. And if you compared that to a capsule, the gummy's always going to be less. It's
Okay,
always going to be
I have some on my desk. That's why I asked. And now, because of one of your previous talks, I'm seeing that it has added sugar at 10% added sugar. So
That's just so it tastes good.
yeah, and not that it helps with blood sugar regulation either.
Right.
And everyone, we still have time. Okay, there's another message here. Oh, thanks. Now, multivitamins, those are also going to be lesser amounts of the individual product.
Right.
Okay. Now I'll move on to being sick in the wintertime. And people say, take zinc. Zinc will fight that cold. What do you think about that?
It actually does help your immune system. It helps your immune system. And I know school teachers and people that work in schools, people that work in daycares, they're around children all the time. In the winter, they will add um, they will add zinc to their regimen. I think Emergency, which was actually designed by a teacher, has some zinc in it. So if you're doing it for part of the year during cold and flu season, I don't get excited about that. When I get excited is if you're taking a separate zinc supplement every day. That is different because it takes a while for zinc to build up in your system. But having said that, still the maximum is going to be 40 milligrams. So if you're taking more than one supplement, anything that can become toxic, you want to run the totals on there. And that's actually something that I do for my clients is if they're taking multiple supplements, I will actually put their supplements on a spreadsheet and make sure that they're not getting toxic amounts of anything.
Oh, that's great. Sherry is asking, with the use of magnesium cream during a massage, affect glucose levels?
It's not going to be enough to affect glucose levels.
Okay. And Sandy is asking, what supplements help with neuropathy?
The only thing that I saw that showed some promise for neuropathy was actually alpha lipoic acid. So there is some data that says that alpha lipoic acid may be helpful in neuropathy. And so there's a lot of research going on in that area. Whenever I have clients that have neuropathy, one of the things that I ask their doctor to do is to actually check their levels of B vitamins. And I have them check the levels of all of the B vitamins because even a subclinical deficiency of one of the B vitamins may affect nerve function. So that's kind of a basic thing that I like to have done when my clients have neuropathy. And you would not want to start supplementing B vitamins on your own because B vitamins are so chemically closely related that you could supplement the wrong B vitamin and feel better, but still have a deficiency of another B vitamin. So I like for my clients to get tested. And if they say to me, I don't have a doctor, can't get tested, then if you were going to do B vitamin supplementation, you would do a B complex so that you're getting all of the B vitamins. You're getting all of them.
That makes sense. Let's see, we have another question. What about credibility of the GMP, good manufacturing practice, label on supplements? What about the credibility of that? Is that
I love that question. GMP just means that the supplement manufacturer says that they are following specific procedures. No one's checking. If a supplement company chooses to have third-party verification, then part of that process, they look at the final product, and they will also go and look at the factory. So when somebody has good manufacturing processes, that little label on their bottle, meaningless.
Yeah.
It is meaningless unless a third-party independent company has tested.
all right? And Susan is asking, is magnesium essential 300 to 400 milligram on average, effective for lowering sugar, or maybe just for the stress?
Okay, that's actually two questions.
Yeah.
So when you are stressed, you do shed magnesium. Certain medications like the proton pump inhibitors, you're not going to absorb adequate magnesium. There needs to be a balance between magnesium and calcium. And for some reason, a lot of people have this aversion to dairy from a cow. And so if you don't use dairy from a cow as your calcium and magnesium source, if you're using an alternative like almond or soy, they add magnesium and calcium to the product, but the pH is not right. So the absorption is going to be lower. So if you're concerned about magnesium, I would actually have your doctor get your levels checked, and they need to check the levels inside the cell and outside of the cell.
And is that a normal process, checking inside and outside of the cell, or do you need to ask your doctor specifically to check both?
You need to ask him to check both.
Okay, thank you.
Yeah, you need to ask him to check both.
I don't see that any other comments or questions have come in, a bunch of good ones tonight. So I would like to just ask you in closing, if you have any last words, anything you'd like the audience to know about.
Well, what I'd like the audience to know about is when it comes to supplements, it is still the Wild Wild West. And I get real concerned when people just go on the internet and buy things because some influencer said so. You need to find someone that is knowledgeable and skilled at this, and not try to go it on your own. That would be my caution, because people on the internet, their goal is to sell you a product. They're not going to really care what happens to you after they sell you the product. That would be one thing. And the only other thing that I would mention is in the North Florida area, we just were recognized for diabetes prevention. So through the CDC, so we are now offering diabetes. So if the doctor said you're pre-diabetic, we now offer classes for that as well.
And that's through
covered by
Cinet.
insurance. Yes.
Okay. Sophia has submitted a last question. What are
Okay.
your thoughts on the IV vitamin providers administering IV supplements through the vein?
Ooh. Okay, that's a loaded question. I would approach that with caution, because when you are taking nutrients in through your GI tract, your GI tract has the ability to regulate how much gets taken in. So an example would be if you were iron deficient, the percentage of iron that you absorb from your food will go up. If you're calcium deficient, the percentage of calcium that you absorb from your food will go up. When you are getting supplementation through an IV, that regulatory step is being bypassed. So in that instance, you are using the vitamins as a drug rather than a supplement. So if you have a reputable provider, and when I say reputable, I'm talking MD, trained in functional medicine, chiropractor, trained in functional medicine. If they've been trained in functional medicine, that's fine. If they have not been trained in functional medicine, I would just be real cautious, really, really cautious.
Good advice. Well, I'd like to say in wrapping up, please watch your inbox tomorrow for a follow-up email with a link to Linda's recording, Linda's contact information, and a copy of her handout. So keep an eye on that. If you don't see it in your inbox by the afternoon, please check your junks or spam folder, or at very least, email me and I'll send it out to you. Also, please note on your calendar the upcoming EDU-TALK Diabetes series, October 15th, will be with Nathan Lesh, and it will be on diabetes, blood clots, and cardiovascular health. And on November 12th, Jennifer Pressimone, an aromatherapist, will present Navigating the Emotional Journey of Diabetes with Scent. And watch your inbox as well for invitations to these upcoming EDU-Talks. Visit the EDU-TALK Diabetes Archive Library, again on ease-z.com. And Linda did a great talk on more than carbs. She also did one about getting through the holidays, which it's getting to be that time of year. So, and then the last one I forget. So you're going to have to go to the archive library and see what's there and listen to Linda's good talks and join us again. Many thank yous to you from the audience, Linda, and we look forward to having you present again in 2025. Thank you so much, everyone. Be safe and take care and be healthy. Thanks.